is Wajdi Fakhoury. I'm the clinical director at California Start Westside in Los Angeles, California. On behalf of my contributing authors, Harmon, Symone, Pompey, Hughey, Nicole Alexander, and Tracee Williams, I'm presenting our poster, Providing Trauma-Informed Care Through Informed Practices. Trauma-informed care is one of the START guiding principles and is understood as essential for behavioral health care. This approach to care for vulnerable populations, such as individuals with IDD, is imperative as these populations are at a higher risk of experiencing adverse life events and trauma in their lifetime. Although individuals with IDD are noted to suffer 2.5 to 10 times the abuse and neglect of non-disabled peers, CSS reports a national PTSD and trauma stressor diagnosis rate of 13% for adults and 9% for children involved in START. Similarly, San Diego, California START and California START Westside report significantly lower rates of trauma. For these statistics, trauma is measured at enrollment by those that have indicated the presence of a PTSD diagnosis and/or the presence of other trauma stressors diagnosis. However, trauma and traumatic experiences are not limited to meeting diagnostic criteria for PTSD. This limited measurement of trauma can be understood as a possible gap in both the measurement and understanding of trauma within START programs. One that, if addressed, could be better insight for START and better allow for the implementation of trauma-informed care for individuals and their systems. The study aims to build on how START measures trauma to gain a better understanding of trauma rates and experiences of trauma by those involved in START, thus helping START be more fully trauma-informed. We hypothesize that limiting trauma to a PTSD diagnosis and other trauma stressors diagnosis is actually underestimating the rates of trauma within START programs. In order to address these gaps, the study will use a combination of START intake checklists and adverse childhood experiences assessment. The START intake checklist will be expanded to include a scale for each category, moving from yes or no questions that measure presence of trauma to scales that can be used to interpret severity and impact of a trauma category on the individual. Also, categories for experience discrimination based on identity will be added to the intake checklist to create a more inclusive list of trauma experiences. With trauma-informed care being concerned with a system of support and re-traumatization, the possibility of care being affected by caregiver traumas is important to understand. The study moves towards including the understanding of trauma faced by caregivers, both in their own lives and traumas experienced vicariously through caring for an individual with IDD by administering the tool to caregivers and including a section for caregiver and clinician impressions. Thank you very much.